1,000 miles from comfort. We have traveled land and sea, but as long as you are with me, there's no place I'd rather be. I would away forever, exalted in the sea. As long as I am with you, my heart continues to beat. With every step we take, Kyoto to the bay, strolling so casually. We're different and the same, gave you another name, switch up the batteries. If you gave me a chance, I would take it. It's a shot in the dark, but I'll make it. Knowing the little hope you can't shame me. When I am with you, there's no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. We set out on a mission to find our inner peace, make it everlasting, so nothing's incomplete. It's easy being with you, sacred simplicity. As long as we're together, there's no place I'd rather be. With every step we take, Kyoto to the bay, strolling so casually. We're different and the same, gave you another name, switch up the batteries. If you gave me a chance, I would take it. It's a shot in the dark, but I'll make it. Knowing the little hope you can't shame me. When I am with you, there's no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. When I am with you, there's no place I'd rather be. I'd rather be. We're 1,000 miles from comfort. We have traveled land and sea, but as long as you are with me, there's no place I'd rather be. I would away forever, exalted in the sea. As long as I am with you, my heart continues to beat. With every step we take, Kyoto to the bay, strolling so casually. We're different and the same, gave you another name, switch up the batteries. If you gave me a chance, I would take it. It's a shot in the dark, but I'll make it. Knowing the little hope you can't shame me. When I am with you, there's no place I'd rather be. No, 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 no place I'd rather be. Yeah. I'd rather be. We're 1,000 miles from comfort. We have traveled land and sea, but as long as you are with me, there's no place I'd rather be. I would away forever, exalted in the sea. As long as I am with you, my heart continues to beat. With every step we take, Kyoto to the bay, strolling so casually. We're different and the same, gave you another name, switch up the batteries. If you gave me a chance, I would take it. It's a shot in the dark, but I'll make it. Knowing the little hope you can't shame me. When I am with you, there's no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. We set out on a mission to find our inner peace, make it everlasting, so nothing's incomplete. It's easy being with you, sacred simplicity. As long as we're together, there's no place I'd rather be. With every step we take, Kyoto to the bay, strolling so casually. We're different and the same, gave you another name, switch up the batteries. If you gave me a chance, I would take it. It's a shot in the dark, but I'll make it. Knowing the little hope you can't shame me. When I am with you, there's no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. When I am with you, there's no place I'd rather be. I'd rather be. We're 1,000 miles from comfort. We have traveled land and sea, but place I'd rather be. I would wait forever, exalted in the sea, as long as I am with you. My heart continues to beat. With every step we take, Kyoto to the bay, strolling so casually. We're different and the same. Gave you another name. Switch up the batteries. If you gave me a chance, I would take it. It's a shot in the dark, but I'll make it. Knowing the little heart, you can't shame me. When I am with you, there's no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. We set out on a mission to find our inner peace, make it everlasting, so nothing's incomplete. It's easy being with you, sacred simplicity. As long as we're together, there's no place I'd rather be. With every step we take, Kyoto to the bay, strolling so casually. We're different and the same. Gave you another name. Switch up the batteries. If you gave me a chance, I would take it. It's a shot in the dark, but I'll make it. Knowing the little heart, you can't shame me. When I am with you, there's no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. No, 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 no place I'd rather be. When I am with you, there's no place I'd rather be. I'd rather be.
Hello and welcome to KidsX 2022 Demo Day. I'm Omkar Kulkarni. I'm the Managing Director of KidsX. I'm also the Chief Digital Transformation and Innovation Officer at Children's Hospital Los Angeles. I'm so happy you're here today. Thank you for spending some time with us today to listen to our second cohort of the KidsX Accelerator Program. KidsX is a global consortium of pediatric innovators that are dedicated to solving the most pressing problems in pediatric care delivery. We function by facilitating this collaboration between leading pediatric health systems and really inspired digital health entrepreneurs. And since we started in 2020, we've prepared so many different digital health companies to best engage with pediatric health systems. A really good example of that is a company from our cohort last year in 2021, a company called Limbix. They have this product that is a digital therapeutic that can help adolescents who have depression. They are currently live with 4 KidsX member hospitals, and as a result, raised a $15 million funding round very recently, and largely due to people that they met through the KidsX program. Another example is Exploro, also from that same cohort, that has done tremendously well. In fact, why don't you hear from the founder now about his experience with KidsX?
Hi, I'm Don Rabin. I'm the CEO of Exploro, and we were delighted to be accepted for the KidsX program. It made a massive difference to our business. Through the program, we managed to secure 5 trials at various hospitals, both in the United States and in Spain. And of those 5 trials, 2 of those have become commercial customers. And we've also got a couple of research studies out of it, which will really help us in terms of proving the value of Exploro. And I guess what I found valuable from the KidsX program were a few things. So one, as a company based outside of the USA, understanding how the US healthcare market worked was incredibly valuable. And I think now, a year later, we've got a reasonably good understanding of the US market, which is incredible. It was also a really good networking opportunity. We're still in close contact with at least 2 of the other startups that were on the same cohort as us. So that was really good. And just the kind of level of personal support was phenomenal. So all in all, it was a tremendous experience for us, and one that I wish I could repeat. And actually, we recommended KidsX to another company we know in the UK, and I'm glad to say they've been accepted onto the latest cohort. So fantastic program. Can't thank everyone enough. Back to you, Omkar.
So this year's cohort of 8 amazing digital health startups is no exception to our KidsX phenomenon. We've already begun to facilitate long-term partnerships between our pediatric health systems and these startups, and we think that by doing so, we can make a tremendous impact in various elements of pediatric healthcare delivery. During our 2022 KidsX Problem Identification Day, this is where we bring together all of our children's hospitals to really talk about what their key pressing issues are. We brought together 23 hospitals a few months ago, and we asked them, what are your main issues? What are the problems you're dealing with and strategic issues that that are top of mind for you? And what was impressive was the issues were really similar across these different health systems. Concerns about mental health, concerns about staffing, concerns about how best to leverage technology to improve virtual care. So that brought us to identify solutions in virtual reality, AI, and virtual care tools that are designed to help address some of the issues that were brought up by our health systems. And you're going to hear those today in our pitch session in a few minutes. But before we start pitch session, I'd like to remind everybody some housekeeping rules. Use the chat function to ask questions, to show support, and to applaud our companies as they talk to you about their solution. And as you listen to the presentations, and this is something I ask of all of my audiences at Demo Day, and I do this myself when I go to a Demo Day, you have a lot of power being in the audience listening to these companies. You have a lot of networks, people who you know in your own health systems or in other health systems, payer systems, investor communities, etc. And if you really like a pitch and you really like what a company's doing and you can think of somebody or some way in which you can help them, please do it. In fact, if each of you watching can do one thing to help at least one of our companies, think about the impact we can make to support this ecosystem in front of you. So with that, sit back, enjoy. They're great pitches, great presentations. They've been working really hard, and I'm eager to present to you the 2022 cohort of the KidsX Accelerator. Thank you.
Hello, everybody. I'm Dr. Jeffrey Gold. I work here at Children's Hospital Los Angeles and the University of Southern California. I'm very excited to be partnering with SmileyScope as their scientific mentor, as we believe SmileyScope can solve many problems that we face here at Children's Hospital with regards to pain, anxiety, and distress for children going through routine medical procedures, sometimes painful and sometimes often distressing. So we look forward to partnering with them, and SmileyScope has been a wonderful company to work with thus far, both through their sales as well as their C-suite, and looking forward to working on this project together. So good luck, and here's SmileyScope.
Hi, my name's Gavin West, and I lead U.S. commercialization operations for SmileyScope. Though we're a U.S.-based company, we were founded in Australia by Dr. Evelyn Chan and Dr. Paul Leone, a pediatrician and a pulmonologist. When they went into private practice, they quickly realized that some of the most common procedures are some of the most feared procedures. 75% of children have fear and anxiety around needle procedures, such as venipuncture and vaccinations. They understood that if they addressed these underlying problems within the healthcare system, they could have a huge effect on not only the lives of patients, but also the healthcare ecoscape as a whole. They set out to create a best-in-class virtual reality system to reduce fear and anxiety within the pediatric population. They succeeded. On the hardware side, our detachable faceplate allows you to quickly access programming, place it back on the headset, and start the procedure in under 10 seconds. It's also antimicrobially impregnated, reducing the chance of infection, and compatible with all hospital disinfectant wipes. On the software side, we offer over 25 clinically backed programs ranging from breathing exercises and mindful meditations to our flagship product, Procedural Choreography, which actually synchronizes the real-world procedure with the virtual world that we're presenting to the patient. We're a little bit different than traditional VR. In traditional VR, you immerse the patient in order to distract them. And though that's effective, it doesn't maximize reductions in pain and anxiety. In order to achieve that, we use a process we call procedural choreography. Well, what does that mean? Well, we don't just immerse the patient, but we align the content between the procedure and the virtual world, and we ask for their participation at key moments. So let me give you an example. In our flagship undersea adventure that we send children on for vaccinations and venipuncture procedures, it's narrated by Poggles the penguin. He walks them through an entire undersea adventure, and at key moments we replace that negative real world stimuli with positive virtual stimuli. For instance, when they're getting an antiseptic wipe or when they're getting an analgesic placed on the arm, fish come in and swim and wash over that area with their tails in order to synchronize the feeling of evaporation with what's going on in the virtual world. When that's time for that actual needle to be inserted or an IV cannula to be inserted, fish come up and nibble and give kisses in those areas, allowing that patient to associate a positive experience in the virtual world and remove a negative experience in the real world. We call that procedural choreography, and it maximizes reductions in pain and anxiety. You can see our results reported in the Journal of Pediatrics. We found a 60% reduction in pain, a 40% reduction in anxiety, and we halved the use of restraints, dropping from 2 or 3 nurses to complete a procedure down to 1, literally half of the time. It's important to note, too, that this study was conducted against the standard of care, which includes parental comforting, a topical analgesic, and the use of a 2D distraction such as a template. We reduced child pain by 60% against a very high bar. In addition to our flagship procedural choreography programs, we now offer exposure therapy for the MRI. We allow that patient to virtually experience what an MRI is like, hear the whir of the magnets, feel the confinement of the MRI tube, and reduce their anxiety by having experienced it before. In addition to that, younger patients can gamify it, turning it into a donut factory or turning it into a spaceship, further reducing that fear by making it fun. And during those programs, we're actually tracking head movement, so we can give you a quantitative measurement about the patient's ability to stay still in the MRI, allowing you to help lane them for sedation or non-sedation protocols. Though we're a US-based company, we launched in Australia 2 years ago and have already been adopted by every children's hospital within the country. In addition to that, during COVID, we were rolled out to every state and national vaccination clinic within the country. International vascular access guidelines now reflect us as a best practice to reduce pain and anxiety during those procedures. Since launching in the US in Q4 of last year, we've been adopted by numerous children's hospitals in the US. In fact, at Rush Children's in Chicago, we've actually helped reduce the number of no-shows for chemotherapy appointments. Scripps News Service did a 3-minute piece that went national on us about a young girl who was actually trying to hide or potentially run away because she was afraid of going to her chemotherapy appointments. Not because of the effects of chemo, but because she was so afraid of needles. She's now successfully completed her round of therapy. KidsX has given us the ability to reach out to numerous hospitals as well, and we're already in discussions with UVA, Arkansas, Children's Nationals, Dayton Children's, Wisconsin Children's, and numerous others about adoption of the product. I mentioned at the start of the discussion that needle procedures are so ubiquitous they can affect the entire healthcare ecosystem. This is true within the hospital itself, whether it's in the emergency department using local anesthetic before suturing, or whether it's for a lumbar puncture, the ability to reduce pain and anxiety for your patient needs to occur in every single department. Because we can have an effect on every department in the hospital, we can also have an effect on the hospital's bottom line. Take anesthesia, for example. Instead of gas-inducing a child to go into the OR, we can go right to IV sedation with the use of SmileyScope. That reduces pain for them, anxiety for them, and moves them more quickly through the OR and PACU. That time saves money. Because we can affect outcomes in every department in the hospital, we can move metrics across the board. We're going to offer you better clinical outcomes. We're going to improve the patient experience. We're also going to improve the clinician experience, and we can return 15 to 20x on your ROI. We would love the opportunity to work with you. Please reach out to me with any questions or to schedule a demo. All our contact information is here, and I look forward to hearing from you.
Hello, my name is Jeff Regalis. I'm a pediatrician and a pediatric cardiologist at the University of Virginia Children's Hospital. I also serve as the Director of Clinical Innovation for our Children's Hospital, and it's my pleasure to be able to introduce you today to Cognita Labs. When we heard their presentation, I was enthralled and interested in their ability to connect remote patient monitoring devices to already existing remote patient monitoring platforms. This is potentially a very innovative solution to how we manage chronic care models, and their ability to do it with an asthma population is very, very intriguing to us, and I think is going to be very intriguing to you as well. With that, I welcome you to enjoy the presentation that you're about to hear from Cognita Labs. Thank you.
Hello everyone, we are Team Cognita Labs, and today we'll be talking about how we can improve asthma outcomes and reduce costs for your organization, as well as the pilots that we're starting with KidsX partners. So, respiratory conditions such as asthma, COPD affect about 10% of the population, cost more than $100 billion, and studies show that about half are avoidable. We specifically address two areas. First is inhaler misuse, where about 90% of patients can't use inhalers properly, so the medication doesn't reach their small airways, while spending more than $1,800 a year on inhaler medications. And second, about 50% of patients are not aware of their disease control before the exacerbations happen. So to address this, we have built a suite of engaging devices to improve both medication and disease control at home. Our team has over 10 years of experience in pulmonary research, starting at Rice University. We have raised $3.7 million in prestigious grants, received 2 FDA clearances, and our products are used by patients in 10 countries. And right from the beginning, our approach has been evidence-based. We specifically focus on improving inhaler use, knowing that adherence and technique correlate strongly with disease control. And second, we know that patient engagement and awareness are critical to outcomes. But how do we fill these gaps without adding burden to providers? Now that's where our self-coaching technology can help. We've built the first smart inhaler, CapMedic, that actually talks and interacts with patients in real time to help them use inhalers correctly. I have it right here. It's a cute little cap. Shake your inhaler as needed. And it talks. Just shake your inhaler, and I just follow all the lights and messages to use it correctly, which makes it really attractive for children. But we've also shown that patients significantly improve their inhaler technique in published studies and commercial deployments. Now, the most powerful feature actually is that the same device can also measure lung function quickly in just under 3 seconds. And it provides instant traffic light assessment, which can determine if you should, say, take extra puffs of medication to improve lung function and symptoms. In addition to our patient-friendly app, we also heavily rely on text-based communication because patients respond with higher compliance. They also receive extra nudges on what to do next, which can really improve adherence to their asthma action plan. The unique part of the solution is that it gives actionable feedback right when it's needed. There's no cloud, remote nurse, or coordination involved until this stage.
This is what we are testing in our phase 1 pilot with CHLA affiliated clinic. The physician will prescribe the device and will track 60-day improvement in inhaler use and compliance to asthma action plan, but without involving any clinical staff. The pilot will demonstrate the power of self-coaching features. The follow-up second phase will then include providers to remotely monitor and intervene when needed. And that leads to our approach to RPM. First, we want to improve disease management without any clinician time, and then engage them only when it's needed. We also utilize sensitive biomarkers for finding early trends. For an example, currently there is no method to track lung function in small kids as they really can't perform traditional spirometry tests. To address this, we have PulmoScan, which is the first FDA cleared device for home use that measures small airway function in children as young as 3 years old. The underlying oscillometry test has shown to be sensitive to outcomes. And that is what we'll be demonstrating in our pilot with UVA children. For the first time, we will track small airway function in preschool children and compare that data against the standard of care. The goal is to really understand the disease control better and predict early decline. All the medication, lung function, and symptoms data are automatically transmitted without patient input. We run advanced analytics in the cloud to identify early trends. Here is one example from our real-world commercial deployment. As you can see in the graph, we can identify dips in the lung function and facilitate the intervention remotely. With this continuous data coming from the patient, we can now understand if the strategy is working and if the medication is being followed. In this particular case, there was no visit to ER or hospitalization. So why CapMedic RPM? So the RPM success really comes down to two factors. First, the patient compliance and engagement are critical. Because of the interactive feedback, patients love using our devices and show high compliance to daily testing. And second, the solution should have high sensitivity and specificity to achieve the high ROI. And we get there with our evidence-based and data-driven approach. At KidsX, we are piloting with 3 partner organizations and engaging with 9 more partners. And we have support from NIH to address conditions such as cystic fibrosis and COPD. If you are curious about our work and think it can help your patient population, feel free to reach out to us on LinkedIn or email or through KidsX leads. We look forward to hearing from you.
Hello, I'm Scott Liebrens, Chief Financial Officer at Children's Hospital Los Angeles. Semantic Health has made it easy for our medical billing staff to code quickly and effectively, while also being able to identify and reduce errors during their day-to-day tasks. I envision Semantic Health being a leader to timely reimbursements due to the platform's ability to streamline billing workflow. Please sit back and enjoy an amazing presentation by Semantic Health.
Hello, everybody. My name is Nicola Sahar. I'm the founder and CEO of Semantic Health. I'm excited today to talk to you about Semantic, what we do, how we help pediatric hospitals, some of the work that we've done with them. Thank you, everybody, again, for having us in this year's cohort. It's been a fantastic experience. By way of background, before I dive in, I'm actually a medical doctor by training and a published machine learning researcher. And I'm very passionate about this idea of really operationalizing our data assets in healthcare. You know, we've spent significant millions of dollars digitizing our data through adoption of Epic, Cerner, large EHRs. But what I've seen, you know, working in healthcare and being around the machine learning technology in other industries is we're just way too far behind in terms of how we use our clinical data to improve patient care, to improve the operation of healthcare, and to improve the business of the hospital. And at Semantic, really, that's our core vision. And I'm excited to talk to you a little bit about what we do and what we focus on today. The high-level problem that we are really focused on solving at Semantic is this inability for healthcare to analyze our clinical and unstructured data at scale. What that means is almost every process that relies on using clinical documentation is manual or error-prone. So really one of the biggest culprits is in the revenue cycle, where we've got 10 administrative staff to 1 physician, significantly manual coding and auditing leading to billions in underpayments, and a fundamental inability to use our clinical data and our claims data outside of the revenue cycle at scale. So this is what we want to solve at Symantec, and we believe if we solve this in the beginning, it will lead to us being able to operationalize our data across the hospital much faster. And what we focus on solving within the revenue cycle is this notion of a coding audit. A coding audit is essentially a double check on top of or after the coding has been done for clinical documentation to make sure that the reimbursement is as accurate as possible and there are not as many denials happening. The problem with auditing right now is it's really being done 100% by people retrospectively and for only 10% of cases. So we don't have technology integrated in a way where we can scale up auditing to provide an accurate double check on what codes we're sending to our payers. And the reason for that is we haven't been able to build out that technology or that process. And that's what we want to solve. And just in summary here, really what's been done in auditing and it traditionally has been, rules-based methods that focus only on the claims data. They ignore the documentation data, adult solutions for adult populations and not pediatric populations, and generic NLP that really cannot identify and deal with the nuances of pediatric clinical documentation. So there's a huge opportunity to really make a powerful auditing solution in the pediatric setting where things are much more complex with the right machine learning technology. And that's what we do at Symantec. We provide a machine learning platform called the Symantec Auditor that can review 100% your claims data, your clinical documentation data right after the coding has been done and identify errors and reimbursement opportunities for you to fix before the claim goes out the door. And so this is game changing for hospitals that we've worked with that really have relied on doing retrospective random sample audits to ensure accuracy. Some of the ROI that we've seen is primarily, number one, large changes in the relative weight that represent significant dollars on that case, faster speed of auditing, so 2 to 3 times faster, and really high agreement rates at 85% plus. So overall, a 5x ROI on the investment in the technology. Some of the examples of errors and opportunities we can catch relate to the principal diagnoses, the SOI and MCCs and CCs, and the documentation deficiencies themselves. And this is what it looks like in action. Really, at a population view, we're summarizing trends and errors that impact the relative weight, grouping them according to the DRGs, and grouping them according to the type of coding error. For each case that we analyze, we can dive in a level deeper into the documentation, identify and flag for you the specific opportunity. This one, for example, is a missed CC or MCC, which significantly affects the case, and map that back to where in the documentation that opportunity is. So your auditors are now much faster at correcting and identifying errors before the bill goes out the door at the end of the day. And that's really the vision, is to make auditing concurrent, real time, and affect 100% of cases instead of retrospective 10% manual random sampling audits. We've worked with 2 pediatric hospitals as part of KidsX on limited pilots, less than 90 days. We're able to get them opportunities around their coding errors, their coding opportunities, and we're happy to work with more pediatric hospitals to prove out the technology on your own specific population. Our vision at the end of it is we start in auditing, we really help make auditing much less manual and error prone, and we scale that process up across the hospital. So if you're interested in learning more, please contact us at contact@symantechealth.ai. Thank you.
Hello, I'm Nathan Sunheimer with the healthcare vertical at Plug and Play. Over the past few months, I've had the pleasure of working with Rayos, and I could not be more excited about their innovative FlowSense technology and their non-invasive wireless solution. The company is just scratching the surface of its potential, and I fully expect it to revolutionize pediatric care. And they could not be in better hands with the vision and drive of their leadership. And with that, I'd love to turn it over to Annalisa Somera, CEO of Rayos. Annalisa, take it away.
I'm Annalisa Somera, CEO of Rayos. I spent the past 17 years working with early-stage startups, wearing many hats, including venture capital and management. I was content with these supportive roles, but things changed when I came across this wearable that comes out of one of the biggest labs in the world, that has the potential to impact the lives of people like my friend Jane here, a gifted student and competitive swimmer. But something called hydrocephalus holds her back. What's hydrocephalus? Well, before I tell you what it is, let me tell you what it feels like. And it feels like a ticking time bomb in your head, caused by too much cerebrospinal fluid, or CSF, on the brain. And there's no cure for it. Left untreated, hydrocephalus can cause severe disability, including developmental delays, memory loss, and even death in some cases. The standard treatment is surgically implanted shunts that essentially drain the brain of this excess fluid that I was talking about. Now, this technology hasn't really changed over the past 50 years. And the problem with these shunts is that they fail almost all of the time due to things like infection, obstruction, dislodgement. And when this happens, another shunt needs to be put in, which means another neurosurgery. Not only that, non-specific things like headaches can bring into the ER. Imaging is used for diagnosis, but it's inconclusive, time-consuming, and exposes patients to radiation. After that, they're either sent home or they go into surgery for more invasive testing. And some patients undergo all of this unnecessarily because they're actually doing just fine. Now, this cycle repeats itself, and no diagnostic technology today assesses what's going on in the shunt accurately in a matter of minutes bedside until today. And that's where Rheos comes in. Rheos has developed FlowSense, a wireless, non-invasive diagnostic thermal sensor that is mounted on a patient's neck overlying the shunt to detect the presence and magnitude of cerebrospinal fluid flow. Now, it kind of looks like a Band-Aid, but in it are sensors that perform spot checks in minutes to detect flow or no flow and quantitative information on flow. Data is then sent to a mobile app. Clinical work has been published in Science and Nature family journals. And this work has brought us a lot of attention in the neurosurgery community. The device has even gotten the attention of the FDA, who granted us a breakthrough designation for the device. What does this mean? A faster path to approval. In terms of products, the first version of FlowSense will be a single-use disposable device for use in the hospital in inpatient and outpatient settings. The second device will allow for more remote monitoring at home. Now, while we're leading with hydrocephalus, we're not stopping at this indication. We have published work for our pipeline technology in other clinical areas and are already starting to build out that portfolio with major academic partners. To help us realize our goals, Rheos has raised over $8 million in dilutive and non-dilutive funding, which includes over $5 million in government grants and winning MedTech Innovator. In summary, Rheos has a platform diagnostic medical device that has been clinically validated. We have an accelerated path to FDA approval, are working with key opinion leaders across the country, and are on a path to market launch in 2022 with a team with deep medical device commercialization experience. Thank you.
Hi, my name is Elena Dykes with the Innovation Program at Primary Children's Hospital in Salt Lake City, Utah. We're incredibly excited to be working with the team at Loved By, utilizing their Nudge platform to engage adolescents with chronic conditions, starting first with diabetes and hopefully moving on in addition to asthma and respiratory conditions. We love the accents that the Love By team has and also their user and patient-centered design principles that we think will really help us to engage with this difficult to reach population. Again, incredibly excited to introduce to you Loved By.
Good morning from the UK. My name is Matt Farah. I'm the co-founder and CEO of Loved By, an organization I co-founded with my wife back in 2018, following an unfortunate event in our family. We have 4 children. This is our son, Jacob, in intensive care following a positive diagnosis of type 1 diabetes. That event prompted us to create a brand to be loved by families around the world with a chronic condition. But today we're going to talk about Nudge, which is one of the platforms that we produce. Nudge is an adolescent engagement platform, and really our primary research told us that healthcare really struggles to engage with adolescents. That transitional period between pediatric health and adult health creates a huge chasm in communication. And of course, that's now exacerbated and getting wider due to the TikTok generation and reliance on social media to consume content. We do qualitative and quantitative work. So here's a piece of work we did in May, 1,000 Gen Zs that told us that only 3% had been communicated through social media, despite almost 50% saying that was their preferred communication channel. We also do research in both clinical, behavioral, and technology areas. So here we can see some work we did around the emotional journeys, where an adolescent becomes more autonomous, disconnected from their parent, and independent, but also the impact in T1 here on their A1C levels during the same period. We spoke to well over 100 adolescents. They told us, don't tell us to track things. We don't want to fill in diaries. They told us, don't tell us what to do. They said that content was created by adults was boring, uninspiring. And they also said that adults don't understand the digital ecosystem that they currently engage within. So we created Nudge. We wanted to use data to drive content, and Nudge is therefore a short form content platform. Co-creation is at the heart of what we do. We now have well over 2,000 pieces of content, lived experience and relatable content, where we take data rather than that manual tracking, and we drive that into social channels. So data that's, content that's only 8 to 30 seconds long, but we push that 4 or 5 times a week. And as I mentioned, we want to drive the content from data, so we connect with Apple Health and Google Fit as consumer devices, but also with specialist partners such as Dexcom. And here we see some of that Dexcom data. So we can see weekday trends in hyperglycemia, and we can see weekend trends in hyperglycemia. This piece of content was pushed to a male 13-year-old, and based on a scenario that was that hyperglycemic trend, so late night snacking or overcorrecting and hyperphobia. And this is the nudge that they would have received based on that data.
I'm so full. I'm going to sleep like a baby. Hey, don't forget the bolus. Yeah, I will. Just give me a sec. Hey, your blood sugar's high. You got to give insulin. Dude. Don't look at me. I tried.
So an amazing piece of content from Levi there. And I mentioned the social channels. So a user can obviously choose to see the content in our platform if they don't have social media. But that particular piece of content here, we see that being pushed out through the Apple messaging services. And equally, as the patient onboards, they can also choose to receive that in Instagram DM or WhatsApp and other networks. Obviously, outcomes are super important. We started through our co-creation by wanting to improve engagement, and we've done that based on previous research that was published around efficacy levels with previous digital therapeutics. We're also continuing clinical trials to show improved A1C, and a Dexcom real-world study to show improved time in range. We also do other studies. We simply took a piece of content and best practice within the NHS, a website about diabetes. Only 5% of the audience said that they preferred that content versus 95% of the audience that approved ours. Obviously, we're growing, so we're currently focused on T1 diabetes, but we're keen to move into asthma, pulmonary, obesity and oncology, and the broader mental health challenges that a chronic condition adolescent has. We want to be inclusive. So as a baseline platform, you don't have to connect with these devices. You can add your age, your gender information and your condition, and you will receive support that is personalized to those criteria. But equally, if you have a device to plug in, such as continual blood sugar monitor, you will receive nudges such as the one that I've just presented. And then other data such as activity, location, etc. You can plug those in where we're able to drive lifestyle adjustment content as well. KidsX has been a totally amazing experience. Broad members of my team or our team have joined, from data science to our clinical teams, software engineering and child psychology. So it's been an amazing process for all involved. And we really are excited about the future. We have now conversations with Texas Children's around potential oncology, but exciting conversations with Intermountain about piloting our T1 platform and also exploring pulmonary care. We've learned a lot operationally as a UK business around reimbursement, validation of our cost model and investment, and obviously alliance partnerships. So we're already an AWS partner, but actually traction now in the US working with AWS through KidsX is very exciting. And I mentioned compliance, FDA, reimbursement codes, and the information we've gained from KidsX has really given us a pathway to future success. So we're always keen to work with you guys on future T1 operational partnerships, but also for co-development in other areas to drive that research and health economics. And then finally, we're a startup business, so we continue to raise money and looking for a US partner. So thank you, KidsX. Thanks to everybody that voted for us. We're very excited about the next 12 months and seeing how all of the cohort members progress.
I'm Steve Chin. I'm a neonatologist at Children's Hospital Los Angeles. I've had the pleasure of working with Astarte Medical and their innovative platform, NICUtrition, which is a EHR integrated clinical decision support platform, helping clinicians unlock key insights and analytics to help provide optimal nutritional regimens for patients at risk. The platform and the company is truly committed and innovative, and they're meeting an important unmet need in an important population. So without further ado, Astarte Medical and NICUtrition.
I'm here today to talk to you about the most modifiable risk factor in healthcare, nutrition. Hi, I'm Tracy Warren, co-founder and CEO of Astarte Medical. We're a clinical decision support platform focused on improving health outcomes in pediatrics and vulnerable patients. As you can see, poor nutrition has an incredible impact on health. Early in life, it can negatively impact growth and brain development, but throughout life, it can extend your length of stay, increase your risk of being readmitted to the hospital, and even delay the time for you to be weaned off ventilation. It's estimated that $15.5 billion a year of additional costs are attributed to malnutrition for patients with chronic conditions. But nutrition is incredibly complicated. There's typically limited access to experts being registered dietitians and nutritionists. There are an increasing number of solutions available from a nutritional perspective, but our patient populations are highly heterogeneous, making it very difficult to know the right solution for the right patient at the right time. And nutrition is really ground zero for our child health outcomes, but 6 to 10% of pediatric patients experience malnutrition. Those may be surgical patients, those with chronic conditions, or those with inborn errors of metabolism. We as a company have chosen to focus initially on the tiniest and most vulnerable of those, being preterm infants. We can survive babies at 22 weeks weighing just hundreds of grams, but 50% experience growth failure and more than 40% neurodevelopmental delays and disability. Further complicating the feeding of these tiny warriors are problems around data access and practice variability. EMRs do not support clinical decision-making as it relates to feeding and nutrition, storing data in a very siloed way and creating a substantial burden of data collection and analysis. Moreover, each hospital has its own feeding protocol, creating variability across units, and compliance varies dramatically within a unit. This results in dramatic disparities in care. We've developed NICUtrition, an EMR integrated application that liberates data from the electronic medical record, aggregates it, creating longitudinal views of a patient's journey. We embed that hospital's feeding protocol right in the workflow, driving standardization. And we can therefore track outcomes and milestones, automating those calculations and saving hours for those clinical teams. Here on the right is just an example of our rounding report that brings together hundreds of data points in a snapshot view to encourage communication and consistent quality decision making. Our solution creates an impact both operationally and clinically. Standardizing to a feeding protocol has been shown to reduce parenteral nutrition by more than 3 days, reduce central line days and associated bloodstream infections, and reduce length of stay by more than 2 weeks, creating a very quantifiable return on investment for our hospital customers. As importantly, by automating and aggregating that data, we reduce burnout. We can increase not only provider but parent satisfaction. And as I stated earlier, we can get our children off ventilation sooner. We're very fortunate to partner with 2 leading Midwest hospitals as our first customers. But we are a platform company. The core engine, Nutrition IQ, that powers NICUtrition can be applied across pediatric patient populations, many of whom I've mentioned previously. And by structuring and aggregating that data, we can support the future of personalized nutrition, including machine learning and those incorporating omics type data such as microbiome and metabolomics. We are a highly passionate and experienced team. My co-founders and I have known and worked together for more than 2 decades. We are joined by world-renowned clinicians, including Dr. Bill Hay, who's our Chief Medical Officer, probably one of the most published individuals in neonatal nutrition, and my scientific co-founder, Dr. Kate Gregory, who's not only a newborn ICU nurse, but a Harvard researcher in early life nutrition. We've been very fortunate to hit our early milestones, not only having active paying customers, but a strong pipeline. We've been able to demonstrate that value proposition and return on investment. We've raised about $12 million to date from this leading group of investors and have runway through next year. Our goals are really to scale our platform not only within the NICU, but to move beyond the NICU into other areas of pediatrics and create strong strategic partnerships. We've been very fortunate in the KidsX program to partner with 6 children's hospitals. Our pilot program through KidsX is a 90-day access to NICUtrition for retrospective data review, enabling hospitals to benchmark their historic performance around feeding and nutrition. And several of our members are contributing to the first ever neonatal nutrition consortium. We're using that de-identified data to support research and publications. And 2 of our partners are looking to co-develop with us beyond the NICU, particularly in the cardiac ICU and in other care pathways. We are a very unique company. We focus exclusively on what we call nutritional intelligence and pediatric care pathways. We hope to have a dramatic impact on outcomes and are looking for strategic and growth partners. Thank you.
Hi, I'm Jonathan Bandel, Chief Innovation Officer at White Plains Hospital.
And I'm Michael Atkinson, Implementation Manager at White Plains Hospital.
We're extremely excited and humbled to be introducing Florio, a company that we've learned quite a bit about in the past few weeks through the KidsX Accelerator program. Florio has developed an immersive virtual reality environment for children who are autistic to learn social skills and other important daily activities in a safe environment.
And I love the product because there's just nothing else out there like it that allows for, as Jonathan mentioned, for children anywhere on the spectrum to learn societal norms in a safe space where they can learn and grow without any fear or judgment or any other reprisals. So please enjoy a presentation from Florio.
Hi, my name is Vijay Ravindran, CEO and founder at Florio. We're on a mission to build a more open and accessible world for the neurodiverse, those with conditions such as autism, ADHD, and anxiety. And we're doing that by building the first behavioral therapy metaverse, a virtual world for the neurodiverse to gain new skills. The mission of Florio is personal for me. This is my son. Shortly after this video was taken, he would be diagnosed on the autism spectrum. And he's been through thousands of hours of therapy to help with his social and behavioral development. For families like ours, we're entering a system where providers and payers are struggling. The diagnosis rate for autism has gone up over 200% in the last 10 years, and wait lists are over 1 year in many parts of the country. Telehealth is really powerful, but inadequate to serve the behavioral therapy needs of neurodiverse kids. So there's a big opportunity for companies like Florio. We've built a talented team to achieve this mission. My background is an early engineer at Amazon, leading the launch of Amazon Prime, and the former chief digital officer at the Washington Post. Our team includes our chief medical officer, a neurodevelopmental pediatrician. Our head of enterprise was an experienced exec selling into the autism therapy market, and we do all of our engineering and animation in-house. The Florio system starts with research-backed, clinically designed virtual reality content delivered through mobile virtual reality headsets. Our system then pairs with a coaching console that runs on a tablet enabling a therapist to provide live coaching, input key data, and to be able to puppeteer as a child experiences a lesson to gain an essential life skill. Imagine the challenge of learning to speak with peers in a crowded hallway.
Accidentally humming that rug commercial jingle.
Or learning the basics of how to cross the street, a task that if you get wrong can literally be fatal. Those are two examples from a growing catalog that now is nearly 200 lessons. We've been able to create skill-building therapy content across early intervention, executive function, social skills in the school, safety, emotional regulation, and the list keeps going on and on. And we're able to capture data today that's not captured in traditional therapy, powering insights and lesson recommendations with a future towards adaptive treatment plan management, pre-screenings, and other digital biomarkers. Florio licenses technology to providers in the autism therapy market. It's a market where only about 50% of the need is served. The main form of behavioral therapy in autism is called applied behavioral analysis therapy, or ABA, a form of cognitive behavioral therapy. By supporting telehealth and growing our content catalog, we've seen a great adoption amongst enterprise providers, going from 11 customers at the start of the pandemic to over 100 today. And last year, the Florio system was used to deliver over 17,000 therapy lessons. We're also working on important challenges in making Florio fit into the healthcare reimbursement system. Our CPT-3 code application has been approved, and we expect it to be published in July 2022. Critical to adoption is the buy-in of clinicians and their clients.
Is that a bird squawking? Great job, you found it. First try. All right, I'll take it. Thank you. Great work, Max. Did you enjoy Florio today? Yes. Great. Good work. Bye. Unbelievable.
That was incredible.
I'm impressed.
Processing language and accessing his language is very difficult for him. And that's where the anxiety comes down, the confidence comes up, and the motivation to come back and keep doing this.
The feedback we get from our customers has been consistent, such as this piece of feedback from Manhattan Children's Center, our first telehealth customer in early 2020. Through the KidsX program, we've been looking at how Florio can deepen its adoption in the growing autism and neurodiversity market. And we've been looking at how this platform can expand into other cognitive behavioral therapy treated conditions. Beyond the neurodiverse conditions of ADHD, anxiety, and autism, we see immersive VR as a critical capability in a telehealth world across a number of other mental health conditions. Through the KidsX program, we've been really fortunate to find two great pilot partners, and we're hoping to add more as we go through the summer. With Texas Children's, as well as the largest autism provider in the US, CARD, we're going to be working on using telehealth to expand services in a way to address that wait list. With Texas Children's and UVA Health, we're also going to be piloting new ways for Florio to be used beyond autism. And we're looking for partners for clinical trial sites, payer trials, and for investors, please inquire afterwards.
Hi, I'm Jenny Baird. I'm the Director of Clinical Services, Education, and Research at Children's Hospital Los Angeles. I've been working with Elemento Health, who have designed a mobile application that provides just-in-time training and decision support for frontline clinicians, customized to the individual organization and clinical environment. This is a breakthrough technology that advances the way we provide critical information to clinicians at the point of care, and I'm excited to see the ways this will advance educational delivery in the clinical setting. Without further ado, let me introduce you to Dr. Roy Berman and his team at Elemento Health.
Hi, I'm Dr. Arup Roy Berman, founder and CEO of Elemental Health. 45 years ago, I lost my little sister to an error in the operating room. This was my first experience with a medical error and my subconscious inspiration to go into pediatrics, into critical care, and take care of children like this. In 20 years of practice across 4 major medical centers, I continued to see patients dying from preventable mistakes. Mistakes made by hardworking, well-educated, well-intentioned staff who simply couldn't pull the information they needed when they needed it. In this world of ever-increasing practices and changing information, our staff cannot get the support they need when they actually need it. The end result is insecurity, lack of confidence, burnout, and turnover. And that means as well errors and waste. Elemento is a team playbook in your pocket. We understand that healthcare is local. At the level of your ICU, your OR, your ED, that's where it happens. We help those team leaders get their staff on the same page with bite-sized practices deliverable in the moment, supporting them just in time. This also decreases care variation and improves quality and safety. It decreases the off-the-line training costs and delivers something contextual. And we do this all with no need for IT. We can think about healthcare as being a team sport, position players working together to get the win. Looking to football, we have a rule book that nobody ever reads. We have training sessions that are non-contextual, in one ear and out the other. Ultimately, what the team cares about is the playbook, in the moment. What are the plays for them right now against their opponent on the field they are on today? Healthcare is no different. We have P's and P's that nobody reads, disconnected training sessions, one and done learning management systems. There is no playbook. Rather, it's a hot mess of emails, intranet, SharePoints, flowcharts, posters above the toilet, and in desperation, people going to Google with God knows what they're going to find. We solve this problem. We give you a solution that is streamlined, is decluttering, it's in the moment, always current, easy to update, web and mobile, seamless access from the patient bedside to your own bedside at home, personalized for you and your team. The way it works is, as a manager or educator, you can pull from our ecosystem of shared content from other clients and adapt practices to customize and fit your need. Or you can send us your own raw content in whatever form. We transform it into structured, bite-sized content deliverable on any device in the moment. But don't take it from me. I want you to hear it from our customers. Here's a little slice.
I've been a nurse for 30 years, and I've got plenty of experience. An infrequent procedure in the middle of the night? Elemento has my back to help me get it right.
What I love about Elemento is I get to see what I want to see in real time, where I am, and I can watch it over and over again with no judgment.
Healthcare is a team sport. Physicians, nurses, respiratory therapists, Elemento Health allows all of the team members to have access to essential information and micro-learning in real time. We couldn't imagine our clinical enterprise without it.
Healthcare is advancing so fast. The future is here. Elemento puts 21st century communication practices into the hands of our frontline staff, helping teams and hospitals work together.
With Elemento's help, RED has been able to keep on top of all of the rapid changes with COVID. And importantly, through Elemento, we've been able to share our knowledge to support hospitals both nationally and worldwide.
I'm a frontline nurse and educator, teaching best practices to caregivers around the world. Elemento helps onboard new hires, visiting staff, and our trainees, helping all professionals work better together.
Thanks, Ashley. The important thing is here that it works. Children's New Orleans, serious patient harm going from once every 7 days to once every 28 days. UCSF, 50% cut in central line infections. Nurse educator work time to prepare and deliver content cut 75%. Wounds, the classifications improving up to 98%. And in children's hospitals, we've seen a 50% decrease in turnover, greater than 50% reduction in training costs, and a saving of multi-million dollars per year. We've got thousands of users coast to coast, spanning pediatric, adult, acute care, ambulatory, and post-acute care. And all of our clients are sharing some and some even all of their practices with each other in this ecosystem that empowers one another and helps accelerate the spread of knowledge industry-wide. During KidsX, we had a couple key milestones. We're scoping now 4 children's hospitals pilots, including Arkansas Children's, and we've closed a $7 million Series A led by SJF Ventures and Sustain VC. We've got a team of doctors and nurses. We know healthcare education. We've got a track record in business and technology of establishing successful companies and about intent focus on the end user. We're Elemento. For the staff, we help you recruit, train, and retain them. For the patients, improve consistency and outcomes. And for the system, it's about cutting labor costs and reducing turnover. Elevate your quality, empower the front lines with knowledge, and engage as one interprofessional team. Come join our movement.
Thank you for joining us for KidsX 2022 Demo Day. I'm Dana Lay, Head of Operations at KidsX. We have enjoyed celebrating these amazing companies with you and can't wait to see what they accomplish with your support. KidsX would not be here without the endless support and guidance from our amazing sponsors. And we'd like to give a personal thanks to the City of Glendale, Cooley, Extra Life Foundation, and Hope Lab for their dedication to advancing pediatric healthcare globally. Please keep in mind, as you leave us today, the change begins with you. We're hoping that these 8 solutions have been what you're looking for to solve your biggest challenges, and we look forward to hearing about how you connected and created change together. Thank you again, and please don't hesitate to reach out to the KidsX team. If you'd like to learn more about these companies, refer a company to our next KidsX class, or get involved with our KidsX Hospital Consortium. We look forward to welcoming you to our ecosystem and further supporting pediatric innovation. Thank you for your time and have a great rest of your day.
We're 1,000 miles from comfort. We have traveled land and sea. But as long as you are with me, there's no place I'd rather be. I would away forever, exalted